Research isn't only conducted to improve our physical health. Many studies also address behavioral and mental health issues.
People tend to talk with people who are like them. People want to talk with their peers.
Julia Foster participated in a study about depression in African American senior adults. As part of the study, Mrs. Foster participated in a small roundtable discussion group.
Lots of times we don't think in terms of depression. We don't use that word. You sat down and you openly discussed your problems and you did not feel pressured. I really hadn't thought of it in those kinds of terms of depression. We were talking more in depth about it. And you find yourself, well, that's me. After you identify it, what do you do about it?
The study was conducted by Dr. Charlotte Brown.
What was it like for you? In my work, one of the things we focus on is how can we help people to understand and recognize depression and engage them in treatment. How can we better provide the services to the people who need it?
We tend to think that it's based on our religious belief.
The study required relatively brief involvement from its participants, but the results are long-lasting.
They really felt that they had given something back that nobody but them could give because it's their own experience. Yes, this kind of research can be done.
Results from these roundtable discussions helped Dr. Brown devise new methods to help people receive treatment for depression. They trained senior adults, including Mrs. Foster, to become peer educators who could take the training into their own communities and inform others at risk.
When our group meets, because we always laugh and we say, well, we know we can't solve the world's problems, but we can listen. And sometimes that's really all a person needs.
So sitting down with a supportive person like a peer educator and reviewing this information can really be helpful. We are making advances in medicine, both in terms of mental illnesses and physical illnesses by leaps and bounds. But we cannot continue those advances if we don't have people participating in clinical research. It will stop. So every individual can potentially help to advance medicine. And by participating in research, we can make sure that medicine serves us as best it can.
Like many clinical studies, participants in mental health studies often benefit from the close observation and continual contact with researchers.
So we really work with a treatment team approach. The treatment is done in such a careful manner in the context of research, and there's so many there's so many controls on what's going on in the research project that you have a lot of confidence about the quality of the treatment that's being given.
I started my employment.
We know every week of every year exactly how a research participant is progressing or not progressing in one of our studies.
Knowing that somebody is just that connected to me means the world. We all know that.
Dana Plumley has participated in several clinical studies focusing on manic depressive disorders, and her involvement has taught her a great deal about her condition.
The research studies have been very interesting. One study I was in, I worked with a nurse practitioner, and I learned how my total body health is important, not just my mental health. Because a lot of times there's the problem when you're diagnosed with a mental disorder that that becomes your primary diagnosis and everything else falls through the cracks. And so she got me interested in having all my doctors connected. I think the clinical term is insight. I have a great deal of insight into my condition. Because of treatment here, I'm educated about my medications. I know how my body reacts to them, and their approach with the team treatment has been awesome.
While the study has helped her personally, Dana says she's also deeply moved by the fact the research findings will result in more effective treatments to help others in the future.
Makes me kind of teary because they're identifying early stages of bipolar now, early stages of mania, and things that I experienced as an adolescent that were problem behavior now are red flags for a serious mental illness. And I like to think that some of my experiences might help somebody else.
If you want your children and your grandchildren to have better medical care than you've had, one way to do that is to participate in advancing our medical knowledge, and you do that by participating in research.
If you have an opportunity to participate in anything with clinical research to help other people, I think it's the most wonderful thing you could do. Absolutely. I have a daughter with Down syndrome. She is a product of clinical research, I think, because she is living a normal life now because of all the interventions that they were willing to come in and do for her.
That it saves lives. That's the main thing I think people need to understand, that it does save lives.
If I can help people understand that giving a little time to help not only yourself but your community, it's not a scary thing because the people who are working with you couldn't be any nicer. This has given me certainly new insight into research, which is very important.
It becomes a real gift for someone to participate in research studies.
It's been one of the major shaping factors in my adult life, and I'm just so grateful to the clinic.
They made a difference in my life.
Clinical research studies change people's lives. Go online or call today to find out how you can be part of the groundbreaking medical research happening at the University of Pittsburgh. Your participation really does make a difference. I'm L.C. Greenwood. Thanks for joining us.